Welcome to AminAcademy.com. In abnormal psychology, let us discuss about alcohol dependence, some case studies. What is alcohol dependence? Being dependent on alcohol means a person feels they are not able to function or survive without it, and that drinking becomes an important or sometimes the most important factor in their life. People who are becoming dependent on alcohol notice they need to drink more to get some effect. They often give priority to drinking over other activities or obligations such as work or family life, or continue drinking despite harmful consequences. For example, liver disease or depression caused by drinking. Alcohol dependence also causes physical withdrawal symptoms when you stop drinking. If you think you may be dependent on alcohol, you should consult your doctor or another medical professional before stopping drinking. You could speak to a health professional at your near hospital. An early sign of dependence is when you need more alcohol to achieve the desired effect. Increased tolerance is a psychological response we have to certain drugs. The more you consume, the more you need to consume to have the same effect. As dependence gets more established, you might find your end of spending most of your time thinking about alcohol or engaging in activities necessary to obtain, consume, or recover from the effect of drinking. Now we'll discuss further detail about alcohol dependence. Alcohol addiction is a chronic relapsing disorder associated with compulsive alcohol drinking, the loss of control over intake, and the emergence of a negative emotional state when alcohol is no longer available. Case studies on alcohol dependence is in abnormal psychology details the multifaceted nature of the disorder, presenting diverse examples of individuals experiencing the condition and its consequences, such as Joan, who struggled with job loss, financial issues, and relationship problems due to his drinking. A 60-year-old boy with a history of alcohol dependence in his father who developed inhalant abuse. A 54-year-old man whose stroke led to increased alcohol use and a subsequent diagnosis of alcohol use disorder. And Mr. Johnson Babu, for example, a young man admitted to a de-addiction center to address his dependency. These are some case studies about alcohol addiction. Understanding alcohol dependence through case studies. Case studies provide rich, detailed examples of alcohol dependence, offering insight into individual experiences. They capture the subjective experience of individuals with alcohol dependence, including the personal and social impact of their condition. Diverse presentations. Case studies highlight the wide range of factors that can contribute to and result from alcohol dependence, such as genetic predispositions, environmental influences, and co occurring mental health issues. Diagnostic and treatment challenges. They illustrate the complexity of diagnosing alcohol dependence and the various approaches used in its treatment, including detoxification, psychotherapy, and the management of associated physical and mental health problems. Example of case studies. Juan's case. Juan's case study reveals the progression of alcohol use disorder (AUD) from a social drinker to a point where it negatively impacts his family and finances. The 16-year-old with inhalant abuse. This case illustrates how a family history of alcohol dependence can be associated with other substances use disorders. In this instance, the misuse of solvent leading to behavioral changes during withdrawal. Mr. Johnson Babu's de-addiction. This example focuses on a patient admitted to a de-addiction center to address his alcohol dependence, showcasing the initial stages of treatment and rehabilitation. Jack's cases. The case of Jax, a recently retired woman, demonstrates how alcohol use can affect relationships and lead to physical health consequences like falls and bruising. Key factors in case studies. History of passion. What are the key factors while case studies taken? Case studies often include detail about a patient's personal, medical, and family history, which can reveal pattern of substances use and potential risk factors for dependence. Physical and mental status. Examination of patient's physical health, mood, and cognition are crucial for understanding the comprehensive impact of alcohol dependence. Social and spiritual factors. These aspects are essential for holistic care, showing how alcohol dependence affects a person's family, social support network, and overall spiritual well being. Alcoholism stems from complex social factors such as peer pressure, family history, cultural norms, and media portrayal of drinking, which normalize or encourage excessive consumption. Spiritual factors also play a role, as a lack of spirituality or a spiritual crisis can increase vulnerability to alcohol abuse, while spiritual practices are often studied as protective factors and pathways to recovery. Alcohol consumption is prohibited, that is haram in Islam, a religious teaching based on the Quran, saying of Prophet Muhammad, Hadith, and Islamic jurisprudence, fiqh. The prohibition of is rooted in verse that describes intoxicants as the work of Satan and is command believers to avoid them, highlighting their impurity and negative physical and social consequences. So far, we discussed about alcohol dependence and some case studies. If you have done, please subscribe our YouTube channel.